Tammy Baldwin, who are fighting Republican efforts to restrict access to care for trans people. And thank you to tremendous partners who are here fighting for trans health, trans rights, and trans freedom. Lindsay Church, Minority Veterans of America, Brandon Wolf, Human Rights Campaign, Fatima Goss, Graves, National Women's Law Center, Kathy Marcello, Modern Military Association of America, and Allison Chapman, National LGBTQ Legislative Researcher. Trans rights are human rights. Healthcare is a human right. Today, we must defend both. Today, we are considering the National Defense Authorization Act, the NDAA, and tucked within this bill is language that would ban TRICARE coverage of gender-affirming care for children of service members. If passed into law, it would be the first anti-LGBTQ law passed by Congress in decades, since the 1990s. And if passed into law, it would force thousands of members of the military to decide between service to their country or guaranteeing their child can get the health care which they need. It would force members of our military between getting their children the medically necessary evidence-based care that is associated with a 60% lower risk of depression, 73% lower odds of self-harm or suicidal ideation, better self-esteem, and better well-being. Gender-affirming care gives people the freedom and the joy of being who they are without stigma and without shame. It gives kids the opportunity to struggle less and thrive more. But the language included in the NDAA does the opposite. It will worsen children's mental health, make kids feel less safe, and worsen hate and discrimination. If Republicans were really concerned with the health of military families, we'd be focused on improving access, shortening wait times, lowering costs, not on issuing unnecessary bans. But this is not about health. It is about hate. This language is the product of a nationwide campaign against trans rights, a campaign that has facilitated harassment of teachers, bomb threats to children's hospitals, and attacks on transgender people. And this is the same campaign that drives legislators from state capitals to Capitol Hill to insist on dictating Americans' health care decisions. We've seen this playbook before. For decades, Republicans attacked the right to abortion. They slowly chipped away state by state and law by law, and today, there is no constitutional right to abortion. Republicans didn't start with a national abortion ban, but they do want to end with a national abortion ban. Now they've turned their attention to gender-affirming care for service members' families. Freedom isn't lost all at once. It happens 1 inch at a time, and as the Senate author of the Trans Bill of Rights, this is an inch I insist that we cannot give. We must fight off efforts of politicians to force themselves into exam rooms. They think they know better than trained healthcare providers and patients. They do not. But they are experts in the oppression, suppression, and repression of healthcare freedom. And their attacks won't stop there. Today, we have the opportunity and the responsibility to fight discriminatory attacks on service members, their families, and their health care providers. We must strike this language, and if we do not, we must vote no on this bill. Because if we give an inch today, they will take a mile tomorrow. We have a fight ahead for us, and it is a fight that I'm ready to take on. And this agenda is driven by Republicans at every level of government who have been leading constant and escalating attacks on Americans' freedom, who are willing to restrict access to health care to score political points, and who are rather spending time attacking the rights of a few than working towards health care for everyone. They intimidate, and they threaten trans people, their families, and their providers because hate and fear is easier than the fight for freedom, equity, and justice for every American. We cannot let them win. Growing up, I was always taught that you can't beg for your rights, you got to take them. Organize, don't agonize. So freedom is not inevitable. It is fought for by people who say no in the face of discrimination, no in the face of invasive laws that seek to limit what health care you can get, and no to the anti-justice and anti-freedom agenda driving attacks on gender-affirming care. To every trans American, every service member, and their families and friends and their communities, I will not turn my back on you. I am with you, and together we will keep fighting. And I thank all of those who are standing behind me and all of those across the country who are extremely upset with what is about to transpire here in the capital of the United States. The symbol of freedom stands atop of the Capitol dome. And that freedom is about to be circumscribed today. It's about to be limited. It's about to be cut back. And freedom is really what is at stake here today. And all of the people behind me and all the people across the country who have this sense of a loss of freedom are not going to rest. We will continue to build this movement for them. And now let me introduce Lindsay Church, Executive Director of Minority Veterans of America. Welcome.
Good afternoon. Thank you, Senator Markey, for your fight. We really appreciate it. Good afternoon. My name is Lindsay Church, and I'm the Executive Director of Minority Veterans of America. I'm proud to represent the voices, the stories, and the issues of our thousands of members across the country and world. I am also a veteran of the United States Navy and a third-generation military family. I was born to a mother in Honolulu, Hawaii, and grew up in Pearl Harbor. As a trans person, there were no supports in place for me growing up. No health care, no mental health care, and no support for the major challenges I was facing. Before the age of 18, I contemplated suicide, wondering if a person like me was even meant for this world. And I nearly took my own life at 16. It's a miracle that I'm alive today. The FY25 National Defense Authorization Act would be a boon to the military and to our allies abroad. In it are pay raises for service members, funding for our allies in Ukraine, and even a contraceptive copay provision that would bring parity to service members and their dependents who still face out-of-pocket copays for their medications. Thank you to the champions behind me for that. But all of that is moot when the trade-off is a gender-affirming care ban for service members' dependents using TRICARE. Today, I'm wearing a bracelet that was given to me when I went to Ukraine last year by some incredible fighters and friends who are fighting fascism and an unjust war that was brought to their doorsteps. I am hard-pressed to believe that the freedom fighters in Ukraine would trade the lives of our military children for the lives of theirs. And for those who will receive pay raises in the military as a result of this bill, there won't be a single dollar that they wouldn't pay when their children are suffering, attempt suicide, or are ultimately led to successful deaths and preventable deaths. Today, I'm standing here with our Senate champions, thank you, Senator Markey, some of whom couldn't be here today, and advocates across the spectrum of issues, all standing here in concert to tell lawmakers to stop playing games with our children's lives. We call on members to strike down this provision and end this attack on service members and their families. Democrats, you have the control and the power to stop this, and we're asking, outright begging you, to come together and strike down this provision. Strike down hate. If this bill passes, as Senator Markey said, in its current form, it would be the first time since the 1990s in DOMA that an anti-LGBTQ bill will become law. If we don't fight with every ounce of our hearts, souls, and power, how will we look at our children and tell them that they will suffer, that will have to suffer in the name of political games? As we stand here, we also call upon President Biden to veto this bill should it make it to his desk. We ask him to stand on the right side of history, and we ask him to stand with us. Up next is Brandon Wolf from the Human Rights Campaign.
Good afternoon, everyone. Thanks for being here. As mentioned, my name is Brandon Wolf. My pronouns are he, him, and I am the National Press Secretary for the Human Rights Campaign, the nation's largest LGBTQ+ civil rights organization. As has already been said, we're here today for one very simple reason. We support military families. And yes, when we say we support military families, that means all military families. Service members and their families make incredible sacrifices for this country. They lay absolutely everything on the line, and we entrust them with our nation's safety, security, and its freedom. And in return, they are owed our respect and the freedom to make their own healthcare decisions. But unfortunately, a bill that is supposed to be about pay increases and improvements to their quality of life has been hijacked. It has been poisoned by anti-LGBTQ+ animus. As you've heard, if enacted, this will be the first anti-LGBTQ+ federal law in nearly 30 years. That's since the days of Don't Ask, Don't Tell and the Defense of Marriage Act. And across party lines, lawmakers have already said that they are fed up with Speaker Johnson's derailing of what should be bipartisan support for our military. House Armed Services Committee Chair Mike Rogers said simply, "This stuff does not belong in our bill." And Ranking Member Adam Smith was forced to oppose a bill he helped to craft, saying, quote, "This harmful provision puts the lives of children at risk and may force thousands of service members to make the choice of continuing their military service or leaving to ensure their child can get the health care they need." That is what's at stake right now. For the families who are in the crosshairs, this is not about a political bargain, it is personal. Take it from the retired Navy captain who was deployed to places like Iraq, Afghanistan, and Syria, who told the Washington Post last week, quote, "I am being told essentially, thank you for your service, we're no longer supporting your family." It's very hard for me to reconcile the idea that the country trusted me to fight in combat, to be shot at, to lead young sailors into combat, but they won't trust me to make a medical decision for my child, the most important decision of my life. Or you can ask the active duty Air Force chief who told The Hill, quote, "I have a strong desire and propensity to continue to serve, but this will weigh on mine and my family's decision. That's difficult, but my family has to come first." Folks, that's the lesson here. We should be putting military families first, not using the health of their children as a political weapon. So as I said, we're here because we support military families. We trust military families. And it's time for the Senate to make clear that they also support and trust our military families. It's time for the Senate to reject attempts to use the National Defense Authorization Act to terrorize the children of our nation's service members. With that, I'd like to turn it over to Fatima Goss-Graves of the National Women's Law Center.
Thank you, Brandon. My name is Fatima Goss-Graves. I'm president and CEO at the National Women's Law Center. And I have to say, I wish that I could only be speaking about the positive things in this bill. It was critical that service members will have access to contraception without a copay. It's an enormous accomplishment. And we certainly are grateful for the champions who work so hard to secure this measure to finally ensure that service members would have the same access to affordable birth control as civilians. That's what the history of the defense bill has been about, right? And the ability to come together, to do common sense things together in service of military individuals and this family. So this country should be proud that they were able to do that sort of thing. But yet we're here today because we're in a situation where right-wing extremists are once again trying to score political points by shamelessly targeting trans kids. And there's no reason that this defense bill should include such baseless and cruel and inherently discriminatory anti-trans measures. In fact, denying medical coverage for trans young people will make it harder for the families who are serving this country and simply just trying to do right by their children, trying to get the best health care they can for their children. And the lawmakers who push for this measure in this bill, they're the same ones. We've seen this playbook before. They're the same ones who don't trust women to make their own health care decisions, who are determined to make it harder in this country for people who are pregnant, who want to take away our basic freedoms. And so now they're trying to tell military families that they're not trusted to make the decisions that they want to be able to make for their family. And if we don't trust our service members, then who do they trust? All of this is a part of a playbook to restrict our freedoms, to force us to control to their very narrow idea of gender roles in this country. I just think young people deserve better. I think families deserve better. And we know that gender affirming care can be life-saving, as you've heard, for young trans people. So we should be doing everything we can to support military families who are already facing challenges associated with frequently moving with deployed parents. So to Congress, to the Senate, we urge you to do the right thing. We urge you to do the right thing and adhere to the promise that you made to protect and to support all of us, including those who serve this country and their loved ones. Thank you. We'll now hear from Kathy Marcello from Modern Military Association of America.
Hello, I'm Kathy Marcello, Deputy Director at Modern Military Association of America. My pronouns are she, her. As Deputy Director at Modern Military Association of America, I work with the thousands of military families that we are talking about. I work with them firsthand every day. And what I want to tell you is that I think for any family, family time is precious. But what I will say is for military families, because we spend so much time apart, family time is even more precious. And thousands of military families will be spending the holidays making choices about if they can continue to serve the country, if they will be forced to live apart, how much financial hardship can they face by paying out of pocket for basic healthcare access. I don't think any family should be forced to make those decisions. I think that military families should not be test subjects for political gamesmanship. To these families, I say we will not stop fighting for you to keep or restore your access to basic healthcare benefits. Thank you.
Beautiful. Beautiful. So,
Hello, everyone. My name is Allison Chapman. My pronouns are she, her. I'm a transgender activist, a national LGBTQ+ legislative researcher, and a proud parent to a gender-fluid kid. I wanted to start by thanking all the senators who have sponsored this amendment. Protecting trans kids puts you under direct fire from right-wing extremists and can compromise your personal safety. That is something I know all too well as a transgender activist. Yet, you are here today because you know and understand that military families need our full support, including those that lovingly support their transgender and non-binary children and getting the health care they need. That is why we must secure the votes to strike out Section 708 of the NDAA, which would remove coverage for treatments if and only if they were prescribed to treat gender dysphoria. This is state-sponsored discrimination, and we cannot allow it to become law. To the families affected by this poison pill provision, I'm sorry that it's gotten to this point. Your child and family should never have to worry about health care. To the trans kids listening today and seeing politicians debate your right to exist, I want you to know that I will always be here fighting for you. You are loved. You are beautiful. You matter to me and so many others. One thing I have learned in the past few years of being an activist is that our joy always shines through, no matter how dark the world gets. As a transgender person myself and a parent to a gender fluid child, I know how it feels to have my own rights and my parental rights under attack. I know the fear that those parents and caregivers feel, the worry that my child will not be able to get the medical care they need to survive. It's the kind of worry that keeps you up at night, the thought that goes through your head every time you see a headline. I constantly wonder if I will be able to call the United States my home forever, or if I will be forced to leave this country to seek healthcare for myself or my children. Imagine being a military parent, serving our country while knowing your child is back home in a state where their life-saving medical care is illegal. Our service members cannot just pack up and move to another state. They must bloom where our government plants them. We are grateful for their sacrifice, and we must show that gratitude through policies that defend their basic rights. As a researcher on national anti-LGBTQ+ legislation, I have tracked the exponential increase in devastating attacks on my community. Politicians do not realize the tremendous harm it does to young people to even introduce a bill with anti-LGBTQ+ provisions, let alone pass it. Studies have shown that the onslaught of anti-transgender laws and the resulting discrimination increases transgender youth suicidality by 72%. Further research confirms what the families here already know all too well. These laws have devastating and compounding effects on military youth, who often have to move state to state and rely most on the consistency of federal health care. I want to take a minute to acknowledge that these attacks didn't come out of nowhere. For the past 3 years, myself and other activists have been monitoring and fighting against anti-transgender laws in states across the country. Since 2020, we have seen over 2,000 anti-LGBTQ+ bills introduced in state legislatures across the country, with 200 of those being enacted into law. Gender-affirming care for minors is banned in 26 states, and kids are dying from it. As a child, I always knew I was trans. I didn't have the words to explain how I felt, but I knew I was a girl. Due to the lack of acceptance, I buried these feelings for many years. When I turned 18, I entered a period of extreme depression, including suicidality. At age 20, I was given antidepressants, and they helped some, but I still felt like a shell of a human. I was just someone going through the motions of life. Coming out and transitioning has made my body feel like home. It's given me something to live for and something to fight for. I'm here today because I was able to receive gender-affirming healthcare. Before voting on this bill, please take a moment to speak to me, one of my colleagues, or a family that is going to be affected by this provision. Consider the lives of the estimated 6,000 to 7,000 transgender children of service members that are going to have their lives changed forever. Our brave service members are willing to sacrifice their lives for this country. Don't force them to sacrifice their children as well. Thank you.
Okay, so we're here to make sure that everyone understands how important this issue is. I was a member of the United States House of Representatives in 1996, and there were 435 members of the House of Representatives. Only 67 of us voted no on the Defense of Marriage Act, and President Clinton signed it. Now, we've come a long way in 28 years on that issue. Defense of marriage no longer exists. So that's what we're saying here today. People understand that this is going to be a battle, but this is what has been created on very short notice, and it is going to just continue to build and build. So, any questions that anyone may have? Yes, sir. Who are you?
Senator Leo Shane with Military Times. Do you think if the president threatened to veto on this bill that you'd be be able to scramble something together as a replacement without this problematic language?
I don't know. That would be difficult to predict what would happen if it would be something that he would issue. There seems to, unfortunately, be a consensus amongst the House and Senate conferees on this issue, but I think it would have potential, but I don't know what the ultimate outcome would be. Yes, ma'am. Who are you?
RebeccaKeelMilitary.com. Have any of you had conversations with the White House about the possibility of vetoing it, considering this is almost definitely going to pass the Senate?
Anybody? Question? Anyone? Thank you all so much. Thanks for being here. Thank you.